Good morning. I'm Jessica Lovell, and we are live from the Dolph C. Simons Jr. Family Broadcast Studio at our Olathe campus. Welcome to the Morning Medical Update World Cup Health coverage. And joining us from our KCK studio is my co-host and my colleague, Alexis Del Cid.
Good morning, Jess. We are so thrilled to bring you this program. The University of Kansas Health System is the official medical services provider for the Kansas City World Cup 2026 host city.
Well, during these morning updates, we will be tracking all things related to health and safety while hundreds of thousands of spectators and reporters and teams are here in the metro. So this is so much fun, really, to be broadcasting from both of our studios. You could call today kind of our kickoff. Now, two big topics of conversation from a health perspective this morning will include the heat index and ticks. But not to worry, because when Kansas City hosts a mega sporting event like the World Cup, public and hospital health planning starts long before the first match. A wave of visitors to any area, as we know, can create a predictable but often preventable health concerns, from heat-related illness and injuries to respiratory viruses. Businesses and restaurants all over the city have already been preparing, and so have we here at the health system.
This morning, we have a great panel for you. You're going to hear from Dr. Brian Beaver. Dr. Beaver is an emergency specialist, and he's the host city health and medical lead. And standing by in our Olathe studio is Dr. Dennis Allen. Dr. Allen is the host city venue medical director and an emergency medicine specialist. And here in our KCK studio is Dr. Dana Hawkinson. Dr. Hawkinson is an infectious disease specialist, and he's medical director of infection prevention and control. And last but not least, we're live at the Jackson County Public Health Department. We're going to be speaking with Assistant Director Ray DeLugalecki. Jessica?
Alexis, thank you. Welcome to Dr. Beaver and Dr. Allen. You both are emergency medicine specialists. And some may remember Dr. Allen from his days as the medical director for the health system's in-field care center at the Kansas Speedway starting back in 2001. Dr. Allen, you have extensive experience with big events, and we're going to get to that here in just a moment. But first, Dr. Beaver, what types of medical needs are emergency specialists and staff really bracing for over the next few weeks?
Yeah, Jess, we're really preparing for anything and everything. You know, looking at prior events like Olympics and other World Cups, you know, we do expect mostly minor illness and injury. So we've done a lot of work around that to be ready to go. But if a patient needs much more care than that, we've worked hard to ensure we are ready to go to take care of them.
Certainly. And Dr. Beaver, we should point out that we have extended urgent care hours. How and why was that decision made?
Yeah, that was a really important decision to make sure that we're taking care of fans, knowing that particularly in areas where we're going to have lots of fans gathered, potentially later at watch parties and those sorts of things, we wanted to make sure that they could get the medical care that they needed even later in the evening. And knowing that a lot of these would be urgent care needs, we wanted to offer that so that we weren't overburdening our emergency departments.
Good call there. Okay, so here's been a big discussion going on, the water bottles, and also what is allowed inside the stadium. What is the rule now, Dr. Beaver, and how important really is hydration going to be in these high temps?
Yeah, so first off, hydration is incredibly important, and I would encourage anyone that's going to be going to any of the events around the city, the matches, Fan Fest, make sure that you're starting to hydrate, you know, even the day before you're planning on being out in the heat. The earlier you start hydrating, the better. At the stadium, the rule is each fan can bring in one clear plastic factory sealed water bottle, 20 ounces or less. So 20 ounces, factory sealed, clear plastic, and fans will be good to go to bring that in the stadium so they've got water.
Dr. Allen, you're watching over first aid stations out at Casey Stadium. What can the public expect in terms of care at these locations?
Well, there's going to be a couple of areas. They'll be outside the stadium. There's a secure perimeter, and then within that secure perimeter, but outside the stadium itself, will be an aid station that people can go to. And then within the stadium will be multiple, as we've set up for other events, multiple other first aid stations that actually are capable of doing some pretty complex care.
You were also chair of emergency medicine for the med school and oversaw the health system's emergency department for many, many years. Do you anticipate the heat index really being the big medical response for your teams?
Yeah, because I think whenever you look at a big event, everything is based, when you look at your projection to patients, it's all based on, is there going to be, how hot's it going to be, and how big's the crowd? And we could have both at this, as we've had at other events. We've done this before. So we know how to anticipate that there'll be a lot of people, and we know how to anticipate when we need to move patients just in areas they just need to get cooled down. They don't really need complex care. They just need to get in a cooler area and out of the sun and get hydrated, and we set up those stations.
It's that preventative aspect of trying to just stay cool and hydrated the whole time.
Yeah, but sometimes people just get behind.
Exactly.
They get excited, they're watching games, and they're not really thinking about, you know, I'm getting dehydrated. It just sort of happens to them, and that's why we're there.
And how are your teams prepping for any emergency scenarios related to fans after the games?
After the game, I think that what we generally, we don't leave until probably an hour and a half after the last fan is out of there. Because a lot of the things that happen after a game are connected to patients' chronic illness. They've come to the game. This is a big event. And people are going to come to these games with a lot of chronic illnesses. They're going to come, you know, they've got lung illnesses, they've got heart disease, but they're like, doggone it, it's World Cup.
And I'm going, no matter what.
And I'm going.
Yeah.
And that's why we're there, to take care of them, sometimes afterwards, or having chest pain, or having trouble breathing. And that's why we're there, to give them a chance to have that experience and get them home safe.
Dr. Beaver, same question as far as inside the stadium. Is it going to be the heat or something else that you think is really going to drive first aid response?
Yeah, I completely agree with Dr. Allen. I think, you know, heat is going to be one of our bigger drivers. You know, hopefully we'll get some few matches with some nice weather where heat is not the main concern. But we always look at, as Dr. Allen said, heat, the size of the crowd, and then how much alcohol use is going on can sometimes influence what we're seeing as well.
And Dr. Beaver, tell us a bit more about the Kansas City Stadium cooling plan.
Absolutely. So we worked with FIFA to kind of consult and make recommendations to them based on, you know, our experience, and particularly Dr. Allen's experience for years at the stadium. And we were able to secure some designated cooling areas within the stadium that, you know, if a fan just feels like they're a little bit overheated, they need to get out of the heat, they need to get cooled down, we can get them to those places without having to bring them into a first aid station and take up a bed that another patient may need in one of our first aid stations. So throughout the stadium on the various levels, we've been able to secure some areas that fans can just go get cooled down in.
Man, those will come in handy for sure. Thank you both for joining us. Dr. Beaver, I know you've got to get going. Dr. Allen, please stick around because we're going to have a few more questions for you, I believe.
Sure.
All right. Well, Alexis, local health departments have also been prepping to handle the health risks related to hot weather.
They sure have, Jess, and hospitals have been working closely with them all year. And FanFest is where you're really going to see much of that work finally pay off. Let's bring in Ray with the Jackson County Health Department. Ray, Jackson County expects 25,000 visitors a day to FanFest. Today's only day 2. What are you advising people with the heat?
Yeah, so I think the most important thing, and this has been discussed, but you know, heat safety needs to be a part of the overall plan from the beginning. It's not something that you should be thinking about once you're already overheated. We're asking people to plan for the heat like they would for traffic, right? We expect traffic, we expect to deal with traffic, we prepare for it. And we build in extra time to deal with it throughout our day. So, you know, thankfully, as has been discussed, there are simple things that can go a long way here. You know, water, shade, brakes, and a buddy system, particularly when we're talking about alcohol, is really all you need to tackle Kansas City summers effectively. And, you know, day 1, Mother Nature showed herself with storms, but we expect, you know, to have to deal with this throughout the tournament. So thankfully, we feel like we're prepared.
Ray, we know the county's been prepping for all kinds of scenarios that could come with mass gatherings. What can you tell us about the public health multi-agency coordination that's underway?
Yeah, so the good news is we've known about this event for years now. This is something that there have been active discussions, planning events, exercises around for a number of years. And any event that is as large as this one that involves elements of large crowds, of international travel, of close gatherings, requires a coordinated public health response. This is just simply too big of an event for one agency or one entity to be responsible for all on their own. And so we at the health department, we've been working with those local, regional, and state partners, including emergency management, our healthcare partners and hospitals, EMS, city governments, event organizers, and even other health departments from across the region to make sure that we can identify those concerns early and respond quickly if necessary. Public health is just one piece of this larger safety net overall. And so our job is to make sure that those health signals do not get missed overall. It's, so that we can work collaboratively to ensure that safe, healthy, and enjoyable event for all folks.
And Ray, speaking of public health, when it comes to people possibly getting sick, what illnesses, if any, are most concerning to the health department right now?
Yeah, so I think we're breaking them out into a whole host of different categories that we're monitoring. Again, when we have those factors associated with large crowds, international travel, they kind of clue us in on certain things that we need to be watching. And so the first for us is going to be our respiratory illnesses. Thinking COVID, flu, RSV. Some of the illnesses that have been known to spread like wildfire if they're introduced into populations, like measles. We're also monitoring, the various stomach illnesses, the norovirus, other foodborne infections. And then, as has been discussed, heat-related illness is also, from a risk standpoint, something that we're very carefully monitoring. But I think the main point I would make is that we're not focused just on a singular disease. In public health, we're watching for patterns because patterns tell us when things are changing and when we need to alter our response appropriately.
We know that the Kansas State Health Department has talked about monitoring the wastewater. Will Jackson County in Missouri be doing the same? And how will the public be updated if so?
Yeah, so we at Jackson County Public Health will be utilizing wastewater monitoring as well. Wastewater monitoring is just another tool that we have to understand what is circulating in the community overall. I like to think of wastewater as like a community health smoke alarm. It doesn't tell us all of the details, but it can tell us when we need to look closer. Obviously, in your house, you wouldn't want to wake up to a 4-alarm fire and have to respond appropriately. The smoke detector, smoke alarm will tell you if something's going on so that you can take immediate action. This is the same thing with wastewater monitoring. We're looking at a whole host of dozens of different viruses and substances all at once to get a better sense of how we need to respond and allocate resources. And we expect to share all of that with the community with other means as well. So with our hospital data, with the what's going on in the ER, all of those things are packaged together for the community so that they get a good sense as to what's circulating in the community, and they can take appropriate steps based on their own risk profile.
Ray, thank you so much. And if you can just hang tight with us a few minutes more, we have some community questions to get to in just a bit, and some of those might be for you. Let's bring in Dr. Dana Hawkinson. Dr. Hawkinson, good morning. You often promote the pillars of disease prevention and control. Remind us of those pillars and why they work so well.
Yeah, the first one is be up to date with your vaccines. So that is vitally important. We know that vaccines are safe and effective and protect you from the worst complications of those diseases. The other thing is understand, please don't go out if you're sick. Stay home. I know it's hard if you're having to miss work or your kids have to miss school, but that will also help keep other people protected around you. Know the situation you're going into. Are you going into an outdoor stadium or like an indoor party to watch the game? So just understand that as well. And then, of course, vitally important is hand hygiene, frequent, adequate hand hygiene, either with soap and water or the alcohol hand sanitizers. That is vitally important. We do pick up a lot of things when we're touching those high-touch surfaces, whether it's door handles, handrails, countertops, etc. And then we put those hands and fingers into our eyes, our nose, our face. We are constantly touching our face, and that is a lot of times how we are getting infected with these common diseases. And then, of course, if you always need to or you feel safer, it's always okay to wear a mask. But I would still continue to promote mostly be up to date with your vaccines, especially measles vaccines at this point, and also the adequate and frequent hand hygiene.
When it comes to an event of this scale with so many people, how does the health system here coordinate with other hospitals in the region?
Yeah, well, just as you heard our guests say, planning starts not a week before, a month before, but years before. And so that is coordination. Certainly we know that the pandemic helped us to better coordinate with our local colleagues in healthcare and public health. We have continued to do that. We have only continued to make those processes and those systems better for, number one, detection, but also care coordination as well. We will continue to do that as this time goes on as well.
One more question for you. We're hearing that ticks, unfortunately, are having a bumper season.
Yeah.
So what are the tick-borne illnesses most concerning to you here living in the Midwest?
Yeah, you know, we hear a lot about people saying, I want to get tested for Lyme. I think I have Lyme. I saw a tick on me. So I think there are important things to note. First of all, really, ticks don't tend to spread disease unless they are attached and feeding on you for more than 24 hours. So that is vitally important to understand. How long has the tick been on you? Second, around here in our region, in Kansas and Missouri, we really don't have a lot of Lyme disease. We certainly have the ticks that can carry Lyme disease, and there may be more progression of Lyme disease into our area, but it is a very, very small and rare event to get Lyme disease in this area. More importantly, we have things like Ehrlichia and Rocky Mountain spotted fever. Those are bacterial illnesses caused by ticks, and more people will get those than Lyme disease. We also have other viruses like Heartland virus and Bourbon virus, which are carried by ticks as well. Now, again, if you are up in the Northeast or even up in Wisconsin or Minnesota, certainly Lyme disease is prevalent up there. But really around here, it tends to be more Rocky Mountain spotted fever and Ehrlichia. So the best things that you can do, not only to protect you from ticks, but also to protect you from mosquitoes, is wear a appropriate insect repellent with DEET in it to help protect against those insects biting you and transferring those diseases to you. But you can also wear long clothes. That will help reduce bites by ticks and mosquitoes. And then if you are out working in the garden or hiking or walking on a trail, when you come in from doing that, it's always important to do a tick check as well. So those things will help prevent insect bites, most notably mosquitoes and ticks, and help keep you safe through the summer.
Dr. Hawkinson, thank you so much. And we know our viewers have questions from time to time during our shows. You can submit those using the chat thread on YouTube or Facebook. And if you're a reporter and you have a question for our doctors, just write your name and the news outlet so we can identify you properly. Jessica?
Well, while questions are coming in, we want to show you how we will be tracking the temperatures and the air quality to better help us all navigate a hot June and very hot July at the peak of grass pollen season. For our visitors, we will be sure to include Celsius temperatures. The National Health Service is predicting a heat index in the high 90s with a temperature of 89 degrees Fahrenheit and 29.4 Celsius. Dr. Allen, many of our visitors may consider, the high 80s and into the 90s pretty hot compared to where they're coming from back home. We've heard physicians talking about taking these cooling breaks. What does it mean to really take a cooling break for a fan who's going to be out for a long time at the game or at the fest?
Yeah, I think I think the idea is before you feel like you're going to pass out, that you understand you're out, it's hot. It's a good idea to, if you've been drinking alcohol, to go ahead and say, you know what I'm going to do? I'm just going to do a bottle of water next. Get out of the sun is something I think is important. Just get out, move around. Again, it's a lot to ask. I think taking water breaks, soccer moves pretty fast, and people are like, and they have very short half times.
Yeah.
So it's like, I really don't want to leave my seat. So I think understanding that just drinking water and the importance of doing that while you're there before you feel bad.
Yeah, you really have a lot of empathy for these fans because you know what's important to them. You know, the soccer is everything. It's hard to be thinking about your health and staying hydrated. It's a lot to manage, right?
All these sports fans, whether they're watching race cars, whether they're watching football, whether they're watching baseball, you know, they want to go out, they want to see their sport.
Yeah.
And I've always thought of our job as giving them a chance to do that and giving them a chance to do that safely.
Well, welcome to the Kansas City area, and if you know it, it's the high humidity making it so much more difficult to stay cool. Why is that?
Well, I think when the higher the humidity is, the more you cannot lose heat through your skin, through evaporative heat loss. Because the humidity is so high that if you sweat, you don't lose any of that. You don't lose any, it doesn't help you lose heat. So I think that's why it becomes so dangerous, because your sweating just isn't helping.
And you touched on this, but let's talk about alcohol on a very hot day. When does this combo get kind of dangerous? And is there a way that people can drink more safely, more responsibly?
Yeah, I think that what you have to be thinking about is taking what, and we've called it at the stadium for years, a water break. And I think it's a good idea before you feel overly hot or overly intoxicated. I think it's difficult to know when you're sitting there and you're enjoying the game that, wow, I've maybe had one or two few minutes. I think one of the things that I look at when I see some of our fans at different events is you probably don't have to buy 4 beers at a time.
You think?
Good
tip.
Maybe getting one at a time.
Good idea.
is a good start. To kind of slow down.
Well, we always appreciate your insight and your tips. So thank you so much, Dr. Allen, for being with us today.
No problem.
Alexis, do we have any community or reporter questions coming in?
We do, Jess. We have a great question from Alyssa Jackson with KSHB. She wants to know, and Dr. Hawkinson, I'll direct this one to you, is hantavirus a concern?
Mm-hmm. Yeah, I think that's a great question. You know, we've seen a lot of news about diseases, very high consequence diseases such as hantavirus and Ebola. Certainly we know that the cruise ship hantavirus outbreak is really pretty much over. Most of those patients who had been under quarantine for evaluating for symptoms have now gone home and returned to their home countries and returned to their homes. We know that Ebola is going on right now in certain parts of the Democratic Republic of the Congo and Uganda. But right now, what I would say is hantavirus is an extremely low risk and low concern. Certainly, we know we have some people traveling from all over the world, countries where it may be endemic. But right now, that is a low risk and low concern. As is Ebola, we know that there are increased steps that are being taken for travel. So we are continuing to monitor for those, especially at the health system. We do have programs in place and processes in place to evaluate for those types of symptoms in people that may be traveling from those areas. But right now I would say that Ebola and hantavirus are extremely low risk. You are probably going to be more at risk of going through an area where there might be a measles exposure, because we know those were happening even before the World Cup and all the travelers that was going on in the United States. We know that is still a possible prospect as well. So you are more at risk of those common diseases and exposures. Again, things like measles, maybe going through an airport or anywhere where there's large crowds, but also just things as simple as common cough and cold viruses, as well as those GI illnesses like norovirus. So that is why, Vaccines, be up to date with your vaccines is vitally important. If you are vaccinated against measles, mumps, rubella, you are protected. There is no reason to worry. Also, adequate hand hygiene. If you are performing adequate, frequent hand hygiene, avoiding putting your hands in your eyes, your nose, your mouth, you're going to be protected from a lot of those other diseases as well. But I would say that hantavirus is an extremely low risk as an answer to that initial question. Yeah.
We have another question from KSHB, and Dr. Hawkinson, I'm going to, well, Dr. Allen may also best be able to answer this. Alyssa Jackson, KSHB, wants to know how late are urgent care hours extended and how much of KU's staff is on site at FanFest? Dr. Allen, do you want to take that one?
Well, I'll start with the different FanFest. The majority of that is on the Missouri side is staffed by the fire department, by the Missouri DMAT, and I'm not sure about our hours in urgent care.
Okay. We'll get, you know what, we'll check on that, and we can get back to our viewers who have those questions online, because we'll be monitoring those all afternoon. Actually, I have that answer for KSHB right now. On select days between June 11th and July 11th, urgent care hours will be extended to midnight at the Medical Pavilion in KCK and at the T-Mobile Center in Kansas City, Missouri. So urgent care hours extended till midnight. We have another question for Ray. This one is for the health department. Cindy wants to know, you mentioned the wastewater tracking and you'll be monitoring those things. Cindy wants to know where she can find those real-time updates, Ray.
Yeah, absolutely. That's a great question. So we'll be sharing kind of the totality of our monitoring program. So that includes wastewater, hospital case counts, that includes elements of syndromic surveillance, looking at symptoms in regards to what people are showing up in ERs. We'll be packaging all of that together. We'll be sharing it on our social media channels. We'll be sharing it on our website. And then our media partners have been really great about amplifying that information during the tournament. So yeah, there's a variety of ways that you'll be able to consume that information so that you can make decisions that are appropriate for yourself.
Thank you, Ray. And we have one more question coming in. This is for Dr. Allen. John wants to know, what are the warning signs of a heat stroke? You know you're overheating. How do you know you're having a heat stroke? Yeah, I think it's you don't feel right. You're lightheaded, you're nauseated. Those are generally the signs that you need to take some action in the heat. Thank you very much for that. And just a note for KSHB, we're going to send you a list of urgent care locations, where they're happening, and the opening hours throughout the World Cup games. Thank you, everyone, for your questions. We really appreciate it, and we'll be answering your questions every Monday, Wednesday, and Friday. Jessica, back to you in our Olathe studio, which is beautiful, by the way.
I know, right? It's so lovely. Yeah. Thanks. Thank you so much. All right. Well, remember, we have you covered on all things health and World Cup. We'll be here, as Alexis said, Monday, Wednesday, and Friday mornings at 8 a.m. on Facebook and on YouTube with all the latest information. And our next update coming up on Monday takes a critical look at when to use urgent care and when to go to the emergency department. It may seem obvious to many of us, but for people visiting from other countries, it can be kind of confusing, and the same goes for pharmacies. So we're going to sort it all out for you, make it pretty easy. Join us Monday at 8 a.m. Alexis.
And we've also put together some short videos with information on all the top health concerns over the next few weeks. You can watch those on our health system website and on YouTube. Feel free to share them with anyone you like. Today's video is about severe weather safety because June is an active severe storm and tornado risk month.
Tune for our encore episode of the Morning Medical Update featuring a young local soccer player who suffered chronic and debilitating leg pain, but not anymore. Thank you so much for watching today. We'll see you back here on Monday.
Kansas City in the Midwest is no stranger to extreme weather. I'm Andy Marshall, an emergency management specialist. I have important tips to help keep you safe before, during, and after an extreme weather event. Keep an eye on forecasts. Local media and government agencies predict the potential for extreme weather in advance. Use that time to get ready at home. In extreme heat and humidity, avoid prolonged activity outdoors. Take regular cooling breaks inside buildings with air conditioning. If you need to be outside, be sure to properly hydrate, drinking 3 to 4 cups of water every hour. Cooling towels and fans may also help you deal with the heat. Take any advisories, watches, and warnings seriously. For those unfamiliar, a watch is when the conditions are present for severe weather, but nothing has happened. A warning is when severe weather is happening or imminent. If lightning is present, head indoors immediately. Grab a weather radio or your phone to receive alerts in the event of a power failure. During a severe thunderstorm where high winds will be present, stay away from windows and exterior walls. Being in a windowless interior room will help to prevent injury in the event of flying debris. Seek shelter in a basement if possible and take your medications with you. Also, wear closed-toed shoes during severe weather events. You'll appreciate it most after a storm passes when the danger might not be over. Storm debris has sharp edges that can cut. In case of flooding, avoid areas of high water, especially when driving. It only takes 6 inches of water for a vehicle to stall and a foot or more to be swept away by floodwater.
There's a period of time where I didn't really know if I was gonna ever get better. I didn't know if I was gonna be able to go back to soccer. So those days were definitely really, really hard.
Coming up today, a high school soccer star sidelined for more than a year. The compound condition that took her out of the game and the multidisciplinary care team that helped her fight her way back. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Today we are talking about resilience, patience, and listening to your body, especially for young athletes who are often conditioned to push through their pain. For Kate Ingram, sports aren't just what she does, it's so much of who she is. But just as her soccer career was taking off, unexplained leg pain changed everything.
I just always loved having a ball at my feet, at my hands, doing anything active. My parents could not keep me still whenever I was little, so I always had to be doing something.
Kate Ingram grew up surrounded with competition.
I grew up with 2 older brothers, so that was always kind of a competitive nature with them. I was always kind of competing with them and wanted to do exactly what they did.
As she grew, so did that passion for all sports.
Okay.
Now, a junior in high school, soccer gets all of Kate's focus.
It was fast-paced, and I just kind of fell in love with it.
She's a star goalie for Sporting Blue Valley Club soccer team. But it was about the time she made varsity as a freshman at Blue Valley West High School that Kate noticed something was off.
I felt all of the cramping in my calves and kind of the feeling of shin splints in my lower legs first, but I just didn't really think anything of it. I was training so many days a week that I was like, okay, this has to be normal.
Kate pushed through, but her symptoms got worse. She was referred to the University of Kansas Health System's sports medicine team. Testing showed Kate had 3 things happening in each leg. 1, running caused her leg muscles to expand so much her connective tissue under the skin tightened, causing an aching and sometimes sharp pain, a condition called exertional compartment syndrome, or ECS, common in runners. 2, her back leg pain was a result of her calf pressing against a vein, a rare but serious condition called popliteal artery entrapment syndrome, or PAES. And 3, Kate had pinched nerves in both of her legs. Kate wouldn't just sit out a game or 2, she was out nearly 18 months.
Just kind of watching everybody get to do what they love and just kind of having to sit back and kind of that feeling that you're falling behind a little bit was definitely really hard.
Kate saw orthopedic surgeon Dr. Brian Vopot. She had several procedures, including a fasciotomy and a neurolysis to release nerve pressure in both legs. Later, she was in the care of Dr. Lisa Vopot, director of the Female Athlete Program that focuses exclusively on the unique needs of women in sports. I
think as an athlete, you kind of just solely think of the physical side of it. And so being able to hit it from all different aspects, I think is super, super cool. And it taught me more that it's a whole body thing. It's not just physically, but mentally too.
After months of strict physical therapy, rest, and recovery, Kate is back to the sport she loves. and shares this advice for others facing a similar fate.
I know it doesn't seem like it whenever you're in the valley, but put your head down, grind, and you will make it out. There will be a victory on the other side.
As for Kate today, she's keeping her eye on the ball and an almost certain D1 college scholarship with her name on it.
Good job, Kate.
We have her mom here with us, Belinda, and we also are joined virtually by Dr. Lisa Vopat. She is the director of the Female Athlete Program at the University of Kansas Health System, and we have Dr. Brian Vopat. He is an orthopedic surgeon with the health system as well. Drs. Vopat, good to see you both. Dr. Lisa Vopat, this is great timing because yesterday was the National Girls and Women's Sports Day. Tell us a little bit about the significance of that.
Every single year, we're sort of nationwide, we celebrate women and girls in sports at every level, both the athlete level, the coaching level, and just women in industry in sport. And it's just to remind us how far we've come and to continue to strive for equity and the good things that being associated with athletics can bring.
Well, here in just a moment, we're going to talk more about the Female Athlete Program that you run here at the health system. But I want to just find out a little bit about Kate and how you're feeling today.
Yes, I'm feeling great today. I'm pain-free. I'm back to playing, so it's been awesome.
So tell us a little bit about the pain you first started feeling. When was that initial pain arising? Because I would imagine as an athlete hitting it hard, you probably feel a lot of pain a lot of the times.
Yeah, so it was kind of the start of my freshman year, fall season, we play club, and I always kind of noticed this feeling of cramping in my calves, kind of this feeling of shin splints, but it was never something that I really thought was a problem until kind of the spring season came around. My freshman year, we were transitioning, we were doing a lot of club stuff, so we were finishing out our club season, but we were also going into our high school season, and so kind of then I was really kind of hitting it hard, and my pain started to ramp up, and so that's kind of when I knew, okay, something isn't right.
So Belinda, you're the mom. Are you asking a lot of questions? I mean, you're with your kid in the house. Are you like, hey, what's going on with you? Are you limping around? How are you feeling? When did you notice there was something going on?
Yeah, you know, I think that there were a couple of things that I started to notice. I mean, one, as she said, there was sort of the beginning of that season, and she would come home and she would say that she was having pain down the front of her shins and in the back of her calves, and you know, I think with the combination of that time of year, I thought, oh, perhaps this is just an overuse issue. But I think the other couple of things that came after that was picking her up one day from practice and her getting in the car and immediately removing her socks and her shin guards and saying, why are these so tight? And why are my legs so fatigued? And I just remember that moment, and she looked a little, her coloring looked a little off, and I could tell that she had really exerted herself. And so I thought, that's interesting. And then I think the third thing was when she was starting the second game of her high school season, and she had been seeing the athletic trainer. And I thought that was interesting, and she indicated that she was just feeling a little instability in her ankles. And she said, and I knew that she was seeing him, but she said, you or Dad, one of you has to come meet with the athletic trainer. Coach says he's not going to play me unless you come meet with him. And so it was in that I realized, something's not right.
You're connecting the dots.
Yeah.
Being very observant as a parent.
Yeah.
I want to bring in Dr. Brian Vopat. Dr. Vopat, Kate had multiple conditions that we had mentioned going on kind of all at the same time. How unusual is that? And how does that complicate when you're trying to make a diagnosis?
It occasionally happens. I think it's something you have to keep in mind when you're seeing patients, that it can be more than one thing at a time. It's not common though. When she first came and presented, she saw Dr. Darsh, and she actually had a drop foot where her nerve wasn't firing on her perineal nerve. And so that's when we first released that. And then she went back to sports. She did well at first, but then she had this pain ongoing. And so that's when we had to dive deeper. So I think it's just all clinicians just have to remember to keep everything in mind when they're seeing these patients.
And earlier we were describing in her story what was going on. Can you maybe kind of in layman's terms explain what she was suffering from and how you treated her?
She had, when she started, she had a weakness of her foot. It's because her nerve was getting pinched right along where it crosses right by her knee. So at first we released that. Then she still was having pain in her legs, coming from two different issues. The first was her compartments, which is this kind of fascia around your muscle, were too tight, especially in these female athletes who have really developed legs and muscles. It can cause a lot of weakness and pain after they've been running. And the second thing she had going on at the same time is what's called popliteal entrapment syndrome, and that's where the artery coming behind your knee can get pinched by overdeveloped muscle and cause a decrease of blood supply to her legs when she's running, which causes pain as well. And then sometimes they can, in her case, be in combination. And initially, her screening exams were actually normal, but she kept having pain. So then we sent her to Dr. Gupta, who did an angiogram, a dynamic angiogram, where they saw that the artery was actually getting pinched off when she was being active. So it was exactly what her symptoms were showing, but the initial test didn't show that until we kind of dove deeper into it.
So, Kate, what was your biggest concern when you first got this diagnosis?
Probably just having to be out of sport for so long. It was something that I'd always done, just something that I'd always loved, and so kind of getting that initial, like, you can't play, was definitely disappointing. And all I wanted to do was be on the field and help my team, so initially it was hard, but yeah.
Yeah, that was a full-on, you got to sit this out, girl.
Yeah.
Mom, what was your biggest concern just when you hear this diagnosis of what's the future going to mean?
Yeah, I think is this fixable? Mm-hmm. It was a beyond soccer question.
So, Kate, you made varsity as a freshman. This sounds like a really big deal. What was the conditioning like? How much more intense was the conditioning for your body? Because you're much younger.
Yeah, for sure. For high school, honestly, it wasn't too much different from what we'd been doing in club. We hit club season so hard that it wasn't too much, but I think kind of hitting both. In the month of January and February, I'm still in my club season, but we also do preseason conditioning for high school, and so I think it was kind of a mix of, I was doing both at the same time, and so it was kind of a whole kind of holes.
Well, and explain for people who don't understand the difference between, high school, you're playing varsity, that's such a big deal, but you're also doing club at the same time. That's year round. That's very, very intense.
Yes.
Explain that to folks who don't understand.
Yeah, so in club season, for me, we practice 4 days a week. We play games on the weekends. And so, every day we're hitting practice. And then on top of it, I'd be doing conditioning for high school. It was only really about an hour a day. But I'd be doing that 3 days a week. So it was 3 extra hours a week. And I just think all of the exertion just kind of is what ultimately.
It's a lot. It's a lot.
Yeah.
Dr. Lisa Bopat, we have mentioned you are the director of the Female Athlete Program here at the health system. Tell us about the concept of this program.
Yeah, so this was a program that we started back in 2022 because we've recognized that females are different beings than males. They have different biology, physiology, biomechanics, access to training, and therefore, the way that we should look at female athletes is different than we should look at males. Also, a lot of the things that we do in sports medicine has been derived on males and not really studied in females. And so the goal of this program was really to step back and look at the female athlete on an individual basis to see how can we improve outcomes. And then as part of that, we made sure that this was a program that looked at an athlete as a whole. We provide holistic care, addressing nutrition, mental health, in addition to the complaint that brings them in to give them the best outcome once we get them through it.
And of course, you're a former athlete yourself. You get it. You help take care of the Kansas City Current. Why is it so important, though, to have a program that focuses specifically on female athletes? Certainly it was about time that this came around.
Yeah, it's just the science has been lacking. We don't know how to do best by females. And so in order to do right by them, we have to have a program that very specifically looks at the limitations in the science, how we're applying that data. And then we also have to look at females as a whole. Like I said, I can focus just on the leg pain, but we also need to look at other causes of fatigue. We need to make sure that we're optimizing nutrition. It's very common for, female athletes to unintentionally underfuel their body. You got to make sure you're getting enough protein to adequately rehab and physical therapy after you have surgery. And then certainly addressing the mental health component is a big part of it as well, especially in a very prolonged recovery.
Kate, how did you handle the we talk about, when you were training and trying to get back physically. How did you handle it emotionally?
Yeah, emotionally, I mean, it was obviously really hard emotionally being away from doing what I love, but I just think I was surrounded by so many resources and so many people that were willing to help me. That ultimately is really what got me through. There were so many people that just were there for me and just made sure that I wasn't going through it alone.
Melinda, what was it like watching her step away from the game that she loves?
Yeah, it was awful. Yeah, I mean, it is hard. I think as parents, you just want the best for your kids, and when they derive their joy, and that is their social life, that is their team, that's their tribe, and to sort of be sucked out of that. And she was sucked out of that for a year and a half. It was difficult. Yeah, it definitely, it was hard.
That support you have to give her in the home,
yeah.
and kind of be that cheerleader, knowing that she's going to get back.
Yeah, and you celebrate a lot of the smallest things. You celebrate the smallest victories. It's it's tough. It's tough.
A question, Dr. Lisa Vopot, for you. How does the mental health factor into the recovery process for young female athletes in particular who are sidelined for a long time? I mean, in this case, it was 18 months.
Yeah, I think that anytime one athlete has one injury, it's incredibly hard, right? Especially in your sort of adolescent, high school, and even collegiate age groups. A lot of your self-identity is wrapped up in being an athlete. It's also your social system. It's how you see your friends. And then to have that suddenly be taken away from you can be incredibly challenging. Kate has been incredibly resilient. Not only did she have one injury where then she got better and then hoped to get back and then was sidelined by another, she had 3. And so that prolonged recovery was hard, and therefore we had to really support mental health through all of it to, again, encourage her that there's, a life on the other side of this, make sure that we're prioritizing to get Kate back to what she really wants to do, and then also to find other self-identity that's not inherently tied just directly to sport.
A question for Dr. Brian Vopot. What are the risks when young athletes ignore ongoing leg pain and maybe try to push through it and don't reach out and tell anyone?
I think what you worry about, especially if the pain doesn't go away, like sometimes you have little things that kind of hurt, but it should eventually go away. It shouldn't hurt every time you go and play or be continual afterwards. The biggest one you probably worry about is actually stress fractures. That's what usually occurs when people when we're exercising too much and not getting enough nutrition, and then that can cause to a fracture, which can cause to a prolonged recovery. And then there's some that are even more difficult to fix, like can have a navicular stress fracture that can be very difficult to fix if they don't report the pain. So I would tell all young athletes that if they have continued pain that hurts every time they play, they just need to tell someone, probably have it investigated to make sure that there's nothing worse going on.
What kept you motivated during this time out?
Yeah, I think just knowing that there's a possibility for me to get back to sport and come back. And also I just think I had so many people around me at the time that were telling me, like, we are going to figure this out. I mean, all the resources that I had, everybody was telling me, we are going to figure this out, we're going to get you back. And so I think that kind of kept me motivated, and also just knowing that there was a sport that was waiting for me on the other side. And so being able to come back from that and just kind of know that I have a story with it.
Yeah, what more motivation do you need than that, knowing that all those folks are waiting for you to return? As a mom, though, when she's cleared to go back to play, what concerns did you have? I mean, we talked about like having kids wrapped in bubble wrap and not wanting them to go out and get hurt again. Yeah. Were you concerned?
Oh, for sure. Yeah, you are, and you kind of always hold your breath, like, is this really fixed? Is it really, is she going to really be okay? And I think early on, I think some of the things I was as concerned about, are her incisions healed? Is she ability to take the impact of the hits on that? So, yeah, just normal, I think. Things.
Mom stuff.
Yeah, normal mom stuff.
Yeah, for sure. Well, we want to show a video from a very special moment. Kate performing the first kick at a Kansas City current match, helping raise awareness for the female athlete program. Kate, what did that moment mean to you, especially after everything that you've been through? I mean, just being out there on that field.
Yeah, it was for sure. It was just a full circle moment, honestly. It was, at the time, I had just gotten back. I'd just been able to play my first game back, and so it was really just this full circle moment of, wow, like, I've overcome everything and I'm on the other side of it and I am healthy enough to be playing.
I called it the field. It's the pitch, right? Did I do that right? Is that right?
Yeah.
Okay, that's the proper term. Okay, gotcha. All right, Dr. Lisa Bopat. Okay, so visibility like this at the professional level there at the current, so important for young athletes watching at home, I would imagine.
Yeah, I think that to have the professional, NWSL Female Soccer League is such a good example for young girls to look up to, because if you see it, you think you can be it. And that was something that when I was little, all we had was the women's U.S. national team. I was a soccer player. And now they have an entire league that girls can look at and strive for. Not only that, we have a lot of professional, female athletes, especially in the KC Current, exemplifying what it takes to be a strong athlete and a good role model in terms of overall health and performance in their sport.
Dr. Brian Bopat, for parents and athletes watching today, when is pain a signal to stop and get help and see a doctor?
I think pain that doesn't go away, or it happens every time you play a sport, something that continues. If it happens for a couple days, it's probably okay. But if something is a continual pain, like every day or every time they practice, or it doesn't get better, then I think that's when it should be investigated more.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Kate, what would you tell another athlete who might be sidelined with an injury right now? What advice could you give to someone?
Yeah, I first say definitely just surrounding yourself with a support system. I think is the most important thing. I think it's really easy to feel alone in your recovery whenever you're going through something like that and being away from sports. So I'd say definitely surrounding yourself with resources, whether that's, friends, family, like systems here at the health system, honestly, really any, just to kind of, have that support system and be surrounded by people who, love and care for you. And also just staying as positive as you can during it. I think it's really easy to look down and say, oh, this is happening to me, or, oh, I, feel bad for yourself a little bit. But I think just staying as positive as you can and just knowing that you're going to get through it.
Valinda, what advice do you have for parents on how to support their kids?
Yeah, I think it's about diligence, and it's about advocacy, and it's about patience. I think the resources are available to us within a healthcare system, but and doctors are somewhat limited within the systems that they work in. But we as parents and as patients have the ability to look for all resources. And I remember utilizing a lot of resources, even just online resources. And some of those resources can be really scary. You can get involved in some groups, and you think, my gosh, do people come out of this? But it also is a way that it educated me, and it allowed me to ask questions and to figure things out. And so I think when you do reach for those resources, and then partnering with all of your medical personnel, I think that is the thing that we can do best for our kids and the people that we love. And just hang in there. It's a long road sometimes, but you'll get there.
Yeah, good advice. Question for Dr. Lisa Bopat: are female athletes more vulnerable to certain injuries, and what type of?
Yeah, they are. Yeah, across the board. I mean, the number one is there's a big discrepancy in the risk for non-contact ACL injury. Females are at 8 to 10 times the risk as males, and it's still something we're really trying to figure out. We're also looking into whether there's differences in other